Thank you to the South of Market Mental Health Services for hosting us. This facility provides much needed mental health support here in our city, and I'm grateful to the dedicated and hardworking staff that are joining us today because we know this work is not easy. I'm joined here today by Dr. Anton Nagusa Bland, who is the Director of Mental Health Reform, Dr. Grant Colfax, who is our Director of the Department of Public Health, as well as Yolanda, who's been a client here for some time, and she'll be speaking to you later today. Thank you for being here and all the folks who are doing the hard work. We know that mental health, there's a mental health crisis here in San Francisco, and I know that we oftentimes hear that word being thrown around loosely. But the fact is, as someone who actually grew up in San Francisco and know that we've had challenges in this city, including issues around homelessness, what I see is something that I've never seen in my lifetime of growing up in the city, and that is people who are in serious crisis, serious need. And the fact is, in San Francisco, the frustration is that we have a lot of resources. We have a lot of dedicated revenues to help support people, but we have discovered that the coordination has to be better. It has to be more efficient to really help people that we know are struggling. And so we have people who have, as we unfortunately know, they're homeless. They have challenges with addiction. They have a number of other ailments, including mental illness, and unfortunately have nowhere to go but the streets. Our Department of Public Health provides incredible care in our city, but there's so much more that needs to be done, and it's not a one-size-fits-all. Everyone thinks that if we fund one program, that's going to solve the issue. But there are so many people struggling with so many different issues, and we need to make sure that we're prepared to meet people where we are. We know that these people are cycling in and out of our emergency rooms and only to be released, be back right in the streets where they came from, our jails. And they're having trouble staying stable in our shelter systems and trouble with maintaining housing. And when I was on the Board of Supervisors, I had a number of clients that I was specifically dedicated to have a better understanding of how the system was working and whether or not it could help to reach them. And sadly, those 3 clients who I am still connected with are still struggling on our streets. We have to end this cycle. We have to do more, and we have to be prepared to make some of the hardest decisions that we've ever made before. Residents like Yolanda are amazing success stories, and she's been a client here since 2009 and has really turned her life around, and I'm really happy to have her here today. The good news is that, you know, when the city focuses and works together to address these issues, we can actually accomplish great things. Back in March, I announced that we were hiring a director of mental health reform because that's exactly what we need to do with this system. Dr. Anton Nagusa Bland stepped up, and he will be speaking a little bit later about what he's been doing since he's taken over this role back in March to get us on track. Today, we are launching an initiative to help those who are the most in need at those cross sections of homelessness, mental illness, and substance use disorder. And our plan is to better coordinate the care. Now, I know you've all heard about the numbers, but the fact is the data with the numbers and the information wasn't necessarily clear. And that is a big part of what we want to talk about today, is what is actually, we see it, we know it's happening, we heard that there was data, but the fact is there wasn't really data and really clear, coordinated efforts. And so the ability to address this issue comes with understanding what is going on with the people, and that includes the data and analyzing the folks who are in and out of our system, understanding if they were offered services or why they refuse services and where they're located after they're refused services. Through this analysis done by the health department through Dr. Nagusa Bland and the Department of Public Health, we have been able to identify 4,000 people with the characteristics of the population who are really in need through these various diagnoses. And of the 4,000 individuals that we've identified who struggle with these particular challenges, 41% are in crisis, which is demonstrated by their high use of the urgent and emergency psychiatric services, and 95% suffer from alcohol use disorder. And the sad reality is what we're seeing is there's a real issue of equity because 35% are African American, despite the fact that we have a population of not even 6% of African Americans here in San Francisco overall. This is just the beginning. The first step of this initiative that we are proposing today is understanding the data, analyzing the data, and also making direct impacts on the particular population and really digging deep into those particular issues with those particular individuals. And now, as a result of what we plan to do about it, this is just the beginning of several initiatives that we plan to announce to really get deep into the weeds of addressing mental health reform in San Francisco. I want to be clear. There's not one thing that we're going to be able to do to address this issue. There are a number of things that we will put forward over the coming weeks to help the public better understand the issue, to help the public better understand and appreciate the people who are working in this industry, the ones who are helping us deal with these issues every single day, to help people better understand that there are folks that we've been able to help and to support, and that many of the programs that we have in place do work, but there is a need for reform. There is a need to increase capacity and to better examine, new ways to address this issue. The first step in the initiative that we're proposing today is to expand individual care coordination for those we have identified. So of the 4,000, and Dr. Nagusa Bland will go into a little bit more detail, but to just really center in on those who are most in need in that population and to really target them with individualized coordination. We also will definitely need to get them stabilized and to streamline the housing and healthcare process because we have to have a safe place for them to be, to recover, to go through whatever process they need to go through to get back on their feet. And we also need to understand that this challenge is not a 9-to-5 issue. And so we're going to expand the hours of our Behavioral Health Access Center so that people can access these services on nights and weekends. Let me be clear that these 3 elements of the initiative are just the beginning. And so we know we have more work to do to improve transparency and the efficiency of our system and to enhance our services and improve what we need to do for the most vulnerable of our city. We are committed and we are ready to roll up our sleeves and to do the work because this is not a political issue. This is about people's lives. And this is about understanding this population so we can get to the root causes and to help people. It comes with a number of various layers of things that we have to do. And I know some of you are familiar with what's happening with our conservatorship legislation and how it's gone through the board and how that is going to hopefully help individuals who are refusing treatment but in desperate need of services. That's one approach. This is another approach. We've already opened a new 100 mental health stabilization beds, and our goal is to open 100 more by the end of this year. And so focusing on specific things to target this population in a way that's going to help turn around what we know we see on our streets every day is something that is so important. Because as we see it, an example, and I'm sure you all have the same example, you may see this person on the same corner every day, screaming and yelling, and I have a particular individual who removes his clothing, and when I think about, when I see him, I can't help but think, you know, this could be my father, this could be my grandfather, this could be my uncle, this could be my family member, and I want to help him. I want to help make sure that he is safe, that he is secure, and that he is getting the help and the support that he needs. It is not humane to continue to allow this to occur on our streets, and that is why we have to move forward with a number of initiatives to help address this. Now, what we're proposing will not, in many ways, be able to solve the issues that we know everyone is facing. We're not going to be able to force everyone into treatment. We know that locally the laws make it very difficult to do something of that nature. But we do need to try. We do need to coordinate our services. And we do need to make sure that we are better prepared to meet people where they are. We can't assume that when they walk into the doors of a place like this, that they know what to do. We need people who are going to be able to help them understand, people who are going to understand what the challenge is and be able to address the challenge. And that doesn't include, here, fill out this paperwork and take care of this and bring your ID. That is not the way we are approaching this particular issue. It's about meeting people where they are. It's about getting the kinds of results where you can see and feel a difference on our streets every single day. So we have work to do, and here to talk a little bit more about what we're proposing and what he's discovered since he's taken on this role as of March of this year is Dr. Nagusa Bland.
Thank you, Mayor Breed, for your support as we embark on this multi-year effort to transform mental health and substance use care for people experiencing homelessness in San Francisco. Thank you, Dr. Colfax, for embracing the scale of the change we need in order to make a difference for this population and for the entire city. Thank you also, Jeff Kositsky, for your partnership in this important work as we endeavor to create safety and stability for our neighbors. I also want to acknowledge the community-based providers and philanthropists, clinicians and researchers, advocates and clients who dedicate themselves to improving and saving lives in San Francisco. We will need everyone working together if we're going to make the kind of impact that this population in San Francisco needs. Here's what we found out about our population. We looked very closely at who used San Francisco's healthcare and social services in the most recent fiscal year. And as the mayor pointed out of nearly 18,000 people experiencing homelessness, we found that close to 4,000 of them also have both a history of serious mental illness and of substance use disorder. We found racial inequity in the population. 35% are Black or African American, when just 5% of San Francisco's population is. 41% of these individuals are high users of urgent and emergent psychiatric services, and 95% suffer with an alcohol use problem. Now, we have seen other large cities analyze their high users of emergency services, usually from a cost perspective. But as far as we know, San Francisco is the first to apply the behavioral health diagnoses of people experiencing homelessness to identifying a population and tailoring solutions to that population's needs. This is how we solve problems in medicine. When a patient comes to us with a complex set of issues, we are not haphazard in our approach. We test. We collect information from collateral sources. We diagnose, and we treat. We use data to precisely target our problems. We innovate, and most important of all, we persist. We are here to solve problems for the entire population and confront a crisis for our city. These are the people who need help the most. Helping them will make the biggest difference for them, for our health system, and for the entire community. When we talk about behavioral health, we mean mental health and substance use. We know that when someone is suffering from a mental illness or addiction, it's a lot like a chronic health condition such as diabetes or even hypertension. When people are in treatment, they do better. When they have a setback, we don't give up. And when 4,000 San Franciscans find themselves at the intersection of homelessness, mental illness, and substance use disorder, business as usual does not work for them. We have to find ways to use the system to bend in their direction. I'm happy to say that this work has begun. As we roll out the first in what will be a series of recommendations, we can say we are entering a new era of collaboration with the Department of Homelessness and Supportive Housing, jointly identifying the people in greatest need and being relentless about getting them on a path to stability and wellness. With other city partners, we will be able to keep track of these individuals so that whenever and wherever they touch our system, a care coordinator will respond. When we say we're increasing access to behavioral health care, and we promise that we're going to focus on these 200 most vulnerable people in this group right now and work together to get them connected to housing, treatment, and care. We will be meeting weekly to discuss each of these individuals and tracking their progress. We will outreach to them wherever they are. We will problem solve and remove barriers to accessing care, and the lessons that we learn will ultimately help us improve the system of care for more people. Going forward, the recommendations I will continue to deliver to Mayor Breed will be driven by clinical expertise, by data, by evidence, and by the most innovative and best practices we can find or imagine. They will promote equity and transparency in our system of care. They will advance harm reduction and lower barriers. They will build upon the Department of Public Health's legacy of addressing problems that might seem intractable and of making stability, wellness, and recovery possible. The clients and staff here at the South of Market Mental Health Clinic show us that perseverance every day. With that, I'd like to introduce Yolanda Morissette.
About 15 years ago, I came to San Francisco because I was being abused, and I fled that relationship. I didn't know anyone in San Francisco. I left my clothes. I didn't look back. And I was also an addict. And I was an alcoholic. And I was homeless. I came out here. I've slept in the alleys out here in these streets, 6th Street Alley. I've been on every street out here that you can name. And through the years, I did want to get help. I didn't know how. And so after some more abusive relationships, I was choosing bad relationships, I finally got a good guy, and it was his choice for us to get clean. He said, we got to get clean in order to make it here in San Francisco. I'm going to stop doing what I can do so that you can get your act together. And so I decided, because I've been in all the shelters out here, I know how the shelters work, I decided to stay in next door. I stayed there for a year, and I behaved. From there, I went into a SRO. They placed me in a single room occupancy is what it's called. You have a room, it's a bathroom, and I stayed there for 5 years. And prior to me, when I first moved into the SRO, my mother was dying of cancer, and she didn't tell me because I knew that she felt it would probably take me out. I had a year clean on me, and I just didn't look back. I said, that's not what my mother would want. I'm going to stay clean. I'm going to fight. So I went out and I found everything that I could find. South of Market was one of the first places that I came to because I had a lot of stuff going on mentally and physically. They were able to help me get on medication. They were able to help me get therapy to get to the root of the problem, what was going on, because I had a lot of stuff going on. And after doing that, I had a lot of anger issues, depression, suicidal thoughts. I had to do anger management here twice, and I finally got it right. And I just started doing other programs. The Glide was out there, Sage was out there. It's not out there anymore. I went to the Women's Reentry Center. I didn't feel comfortable at first because they walk you over there when they let you out of jail. I've also been incarcerated out here in San Francisco for drug possession and other things of that nature due to my, my drug use. And so I just slowly said I'm going to build myself up, and I started doing things for women against rape and violence. I got an award from the DA. I like to write. I started writing here. I found out that I'm a pretty good poet, and I do I do poems here every year for the Black History Month. They embrace me here. I've been coming here since 2012, getting support and getting help. And I've graduated from a lot of programs out there, and I started doing peer mentorship through San Francisco State. I've graduated from Rams. I've graduated from NAMI. I expunged my record. I got my driver's license back. 5 years into my SRO, there was a program called Brilliant Corners. They came and gave out vouchers to people who are willing and ready to move out of the Tenderloin. And I had 2 weeks left, and I fought hard, and I found me a one-bedroom, and I got out of the Tenderloin. But I still come to the Tenderloin because this is an issue. I know a lot of people here, and I always want to do anything that I can that's going to support and help the people in the community. So I continued. I'm still with my guy. We're getting married this year, and thank you. And also, I want to say that I was able to get a really good job with Jail Behavioral Health Services through Health Right 360. It's called MAPS, and it's mentor and peer support. They give you a job on lived-in experience. They give you schooling for that. So I was able to do that, and now I teach groups in jail. I teach groups to the men in San Bruno on domestic violence. I teach groups to the deputies about crisis intervention training. I go out and volunteer. I do anything and everything that I can to support anyone. We work in all the collaborative courts. Now, I was an addict 9 years ago, and this is what I'm doing now. Through all the help that started here at South End Market, they really helped me out an awful lot. They were very patient. I went through several therapists and psychologists, but finally got it right, and I'll be flying away and graduating from here soon because I'm moving on to other things. I have a nice full-time job now, and so, yeah, that's about it.
Well, thank you, Yolanda, for sharing your story. It's amazing. It's an inspiration to us all. And we wish you the very best as you get your certification in drug and alcohol counseling. Yes. Amazing work. So, and also, by the way, we're hiring. So, just putting that out there, always looking for the right people. I'm Dr. Grant Colfax, the Director of Health for the City and County of San Francisco. And I would like to thank the mayor, and thank you, Dr. Negosa Bland, and thank you to our host today, Natalie Henry Berry, and the hardworking staff here at the South of Market Health Center. This is one of the many places in the city's system of care where people can get their medical care, dental, and behavioral health care needs met under one roof. I've seen what the staff here, with persistent compassion, have been able to do by partnering with their clients on journeys to stability and wellness. They are psychiatrists, pharmacists, behavioral health clinicians, nurses, and support workers who go out into the community and meet people where they are. Many clients are experiencing homelessness when they enroll in services here, and most are diagnosed with both mental illness and substance use disorders. But the work makes a difference. And on my last visit here, I went out with the team and visited a client who's now housed, but who was on the street for many years. Wheelchair-bound, had chronic alcoholism, refused treatment for many years. But the team continued to engage him, continued to build the relationships. helped him when he was ready to get housing, helped him when he was ready to get treatment for his alcoholism. And this client, living in the Tenderloin, is a valuable member of the community, is actually continuing to move that forward, just like Yolanda. He is now volunteering at the San Francisco AIDS Foundation, providing harm reduction materials for people who need them. So he's really moving the work forward. And I think this is the kind of model of peers helping peers in a system that meets people where they are and does whatever it takes to help get them off the street. And with this new data and with our focus on the 200, we can make a difference. And I think when people are ready for treatment and volunteer for treatment, that's key. And I also think we need to recognize that one of our challenges on the streets is that some people will refuse treatment. Some people in the most dire need of treatment will refuse treatment. So we need to be there when people are ready to go into the services and meet them where they are when they're ready. But we also need laws like the conservatorship law to provide people with the support for short-time conservatorship to help them save their lives. These are life-saving interventions. And that persistent compassion is what we have seen here, and it's what we've come to expect from our Director of Mental Health Reform, Dr. Ngusa Bland. In a few short months, he has transformed the way many of us think about caring for people experiencing the intersection of homelessness, serious mental illness, and substance use disorders. This is a population, as you've heard, of 4,000 people who require specialized solutions. It can take a while. It can take time for them to achieve their goals. But we know that wellness and recovery is possible, as you've heard today. And with our partners at the Department of Homelessness and Supportive Housing, thank you, Jeff, for being here today, and the Human Services Agency, we've agreed for the first time on ways to identify, treat, and house the most vulnerable population in our city. In Mayor London Breed, the Health Department has a champion of harm reduction, someone who understands the inequities that lead to poor health outcomes that we must continually push harder to overcome. Under her leadership, San Francisco continues to invest in healthcare and housing that our city needs. Thank you, Mayor Breed, and thank you all for being here today. Thank you to the team, and let's move forward together.
Thank you. And again, thank you so much, Yolanda, for sharing your story. And stories like Yolanda is why we do the work. It's what we care about the most. Because the fact is, you know, people go through challenges. People go through struggles. And 9 years being clean and sober takes a lot of work. It takes a lot of courage. And to get up here and tell your story will have such a tremendous impact on so many other people's lives and hopefully encourage them to get the help and the support that they need. And I think that's important to remember in having the conversations about the struggles and the success stories, because we are not going to give up. And I know that people in San Francisco are frustrated by what they see on our streets. I'm frustrated, but I'm not going to give up. I think it's important that we have ways to help people, that with our additional $53 million of investment in behavioral health programs and our additional $100 million in investment to homeless supportive services indicates that we're willing to make investments. Now it's time to put those investments to good use and to understand that every dollar we spend on this issue is a dollar that can change someone's life. And so we have to be deliberate in our approach to really focus on this and make sure that it is not a political issue. This is a long-term plan of action that will deliver the kind of results that will help people like Yolanda get really a second chance at living a healthy, productive, and thriving life here in the city and county of San Francisco. So I want to thank all of you for being here today. And again, I want to really express my appreciation to the team and the folks who are working with so many of the clients that I know things can be challenging. But the fact that you're here, I know that you're not giving up. I know that this work is rewarding, especially when you're able to get the kinds of results that show that, you know, supporting people like Yolanda could really yield. And so it really means a lot to have so many incredible, dedicated people doing this work every single day, because it's not easy. And I'll tell you that, you know, because you all know that I spend a lot of time walking the streets and having the conversations and going out there with some of our teams, with Jeff Kaczynski, and having the conversations. And within 2 hours of walking just 4 blocks, I was mentally exhausted with the conversations that I had, and also trying to get people the help and the support that they needed, and just the work that the energy and the emotion that goes into trying to help people every single day is something that's admirable. And I want us to really appreciate the folks who are part of, you know, our mental health teams and our nonprofit organizations and our homeless outreach workers and even law enforcement, and the work that we're out there doing to try and help change and save people's lives. So this is just the first of many steps that we plan to take. And again, this is, I know, a very complex issue. It's not wrapped in the usual political package that the press, I know, wants to see it wrapped in, but this is actually what we need to do. Get into the nuts and bolts, make the right decisions, get out there and make the changes that will help impact the people that we are here to serve. So thank you all so much for being here today. And Dr. Colfax and Dr. Nagusa Bland will be here to answer any further questions that you might have. Thank you.